Hi, my name is Chad. Today we're going to be going through physical therapy burnout. Along with the presentation today, I'll be providing a quick survey to determine if you are at risk for experiencing PT burnout. So getting right into it, what is physical therapy burnout? It's a condition producing several negative effects in an individual's physical, psychological, and social life that can lead to decrease in quality of care, as well as work absenteeism, low spirit, and potentially even quitting your job if it gets bad enough. And then the three dimensions of burnout, or the three most important things, are emotional exhaustion, depersonalization, and diminished personal accomplishment. And we'll be going through each of those in depth more throughout this presentation. So why is it important? Why is physical therapy burnout important? In the short term, it can cause that decreased quality of care with your patients. So that's going to end up leading to decreased patient outcomes. And once your patient has decreased outcomes, they're going to end up going back to their primary care provider. And then once they go back to their primary care provider, it's going to end up having some long-term effects as well, including increased strain on the healthcare system because they're going to have to get new referrals and go back into physical therapy. So that's going to, in the long run, put more strain on our healthcare system and potentially even cause more burnout, increasing patient demands and the number of patients that therapists may have to have on their schedule. And then from a personal level, it's going to be harmful to mental health. So not being able to leave your work at your work, you're going to be taking it to home life. It's going to lead to depression and anxiety, and we'll get into those things a little bit more in this presentation as well. So some statistics on physical therapy burnout. There's a couple studies up here. The biggest one being the top one, it was most recent in 2018. 29% of 1,400 APTA members were surveyed to have high emotional exhaustion, and once again we'll get into that on the next slide. And 13% of those therapists having physical therapy burnout already. And then on the bottom I found another recent study basically saying that physical therapists have the same level of emotional exhaustion as physicians and nurses, which are very high demand jobs, further implementing that basically physical therapy is a really high demand job emotionally. So what is emotional exhaustion? We'll get into it a little bit. It's listlessness, lack of enthusiasm, and exhaustion of emotional resources. So this picture on this slide is a really good indicator. Someone on top is a normal, healthy physical therapist, kind of draining towards the end of the week, using that weekend to recover. And then someone on the bottom, or the person on the bottom, is experiencing emotional exhaustion. So they're really burned out by the end of the week, and they don't have as much energy put back into them when they come into work on Monday. So some contributing factors: working with high trauma patients. That could be anyone from traumatic brain injury, spinal cord injury, patients that are going to be really demanding, not only from a physical level, but an emotional level, being empathetic with them. And then multiple patient deaths. So if you work in an acute care facility or a skilled nursing facility, sometimes it's common to have patients pass away while you're working with them, which is very emotionally tolling. And not having a good team setting to be able to talk to that with your other employees, or having the necessary resources to deal with that type of trauma. Those are contributing factors that can lead to that emotional exhaustion. The next one we discussed was depersonalization. So what is that? It's characterized by negative attitudes towards peers, colleagues, or patients, and it's kind of that emotional disconnect or that loss of empathy. So this picture is a really good representation, having that feeling that your patients are mostly just on a conveyor belt kind of coming through. You're not able to emotionally connect with them. You're just treating basically their diagnosis, getting them out the door. You're not having that empathetic, real emotional connection with them. So contributing factors to that: excess workload. If you're overworked, it's going to be hard to connect one-on-one with patients. Conflict with patients or staff, as well as job insecurity and low salary package. So if you're not feeling like you're valued or being respected at your job, you're going to feel like you're having a hard time really connecting with everyone. The last one that we'll discuss is diminished personal accomplishment. So what is that? Absence of external or internal recognition for satisfactory work. So example is having awards given to you, having pride in your job, or just receiving gratitude for the work that you do. And that can come from yourself, so having pride in your own work, patients saying thank you, things like that, supervisors, bosses, or your employer overall, whether it be receiving awards, just saying, hey, thank you for your service, maybe buying you lunch one day or your whole staff lunch, just as an appreciation type thing. So contributing factors to that: unevaluated work, so not having normal, regular scheduled evaluations with your supervisors and peers, existing stressors in personal life, so not being able to leave that at home, those things at home, administrative tasks, levels of education, and years of service. So feeling like you're not as good as your peers or your colleagues at work. Personal burnout indicators or contributors. This picture here is a really good one as well. There's a couple basic things, exhaustion being one. There could be physical symptoms like headaches or cramps in your stomach, and then poor performance. So these can come from unrealistic expectations, feeling undervalued, so that comes back to that depersonalization. Feeling stuck at your job is a really big one, feeling like you have to keep this job, whether it be to pay off loans or to maintain your current lifestyle. And then lacking mentorship, so not having that person to go back and talk to or evaluate your work and bounce questions off of. So identifying personal burnout, there is one really good tool, the Maslow Burnout Inventory, the Human Services Survey, that was created in 1981. And there's an example here as well that helps you identify emotional exhaustion, depersonalization, and personal accomplishment deficits. And as well as I talked at the beginning, I created my own risk identification survey, so you can see where you're at, and we'll hand that out at the end so everyone can do that for themselves. So what can you do, or what can I do to contribute or combat burnout? A couple things: self-care, so using your vacation time, don't feel guilty about it. It's given to you for a reason. Take that mental break when you need it. And then finding stress-relieving techniques, one being exercise. There was a study done in 2018 showing that there could be positive effects in patients with burnout syndrome contributed to exercise. They didn't find anything specifically, but they said that there could be contributing factors there. Speaking up, so if you are having trouble, telling your boss, telling your supervisors, telling even your peers that, hey, I'm having trouble, can we talk about this? And voicing concerns, they can lead to productive conversations and eventually help in the long run. The number one thing not to do is nothing. You don't want to do nothing. You want to help yourself. You want to help your patients. You want to speak up and say something about it. So in the future, how to prevent burnout? First thing is identifying it, which hopefully today's presentation will help do. Second thing is education, so educating colleagues about what is it, how to spot it, and how to prevent it, which again, you can point them to this presentation. The last thing being mentorship, so finding someone to openly communicate with your struggles, finding that mentor, or even maybe it's a colleague or a peer, and then becoming a mentor, so educating others about this type of burnout. And these are my references, and I thank you so much for your time today. I'll hand out that survey now.